Good evening. How you doing? My name is Jonathan Risen. I'm a third-year resident in PM&R at the University of Minnesota. I am usually doing this on Sunday nights. Tonight is Monday night. Tonight we're going to be talking about electrodiagnosis, electrodiagnostic medicine. I mentioned I'm a third-year resident in the program. This is not a University of Minnesota sponsored event. I'm not representing my employer, and none of this is medical advice. So if you have a question, ask your healthcare provider. This is educational. That being the case, we're going to talk about electrodiagnosis, what it is, why it's important, and what you should know about it. So if somebody has an injury or they notice that they start having different kind of feeling in their hand or weakness, so they're just not feeling right, they go to a doctor, and the doctor might say, okay, we think you might have something wrong with one of your nerves. So what do our nerves do? Our nerves, our peripheral nerves at least, they exit the spinal cord and they innervate different parts of our body. So for my index finger, for instance, there's a component of my finger that is going to be responsible for sensation of the nerve running through my finger. Then for the strength, temperature, they're all going to be a little bit different. And basically what electrodiagnosis is, so it's two words, electric, and diagnosis, and or electrodiagnostics. And what it is kind of like imaging. So you want to know what's wrong with somebody's leg or what's wrong with somebody's hand. You might get an X-ray. You might get an ultrasound. That picture is going to tell you a little bit more to help complete the story. Electrodiagnosis is similarly going to be telling you something about how their nerves are functioning so you can better understand and categorize what type of injury has occurred. So there are two general components to electrodiagnosis. One is called nerve conduction study, and the other one is called electromyography, also known as EMG. So if somebody's told you, I think you need an EMG, or if somebody was learning about an EMG, that's electromyography. So they do test for two different things. Nerve conduction study is a way to test how well current is passing through a nerve. So let's say my hand is hurting. Let's say I have carpal tunnel syndrome. Carpal tunnel syndrome is diagnosed when you have an electrodiagnostic study. So I might have numbness or tingling in my hand, or maybe I have weakness. We know that different nerves innervate different parts of our hands. They're responsible for strength and sensation. So let's say my doctor thought that I might have carpal tunnel syndrome. Well, they would send me to a neurologist or to a physiatrist or PM&R doctor, which is what I am, and the doctor would perform electrodiagnosis. So what would that look like? Well, there's a couple of options. If my hand isn't working well, or if I have a nerve in my hand that's not working well, what are the possible reasons? Well, it's possible we can start at the hand. It's possible that I have a nerve entrapment at the hand. Maybe I have a muscular disorder, Lou Gehrig's disease, or ALS, or myasthenia gravis, or Lambert-Eaton syndrome, or lots of these different types of syndromes or disorders. They can be diagnosed with electrodiagnosis. So you have to understand the physiology a little bit. For my muscle to work, attached to the muscle, what do you mean by nerve entrapment? That's an excellent question, and I will clarify. So your muscle connects with a nerve. And let's say I want to move my finger, my brain is going to send a message. It's an electrical message down my spinal cord. It branches out through a peripheral nerve, and the nerve is going to reach what is called the neuromuscular junction, which is where the electric signal has to connect to muscle, that when the electric signal reaches the muscle does its motion. So signal comes, the muscle has to contract. So if I have an inability to move a muscle of mine, what are the possible reasons? So a nerve entrapment is, I'll explain. Your carpal tunnel, if you've ever heard of carpal tunnel syndrome, is almost like a U. If you imagine you're looking down the length of my arm, and my face is my hand, and you're looking at my hand, you have nerves and arteries and veins that run through the carpal tunnel, which is right here. At the top of the carpal tunnel is a ligament called the flexor retinaculum. That ligament can get compressed and compressed and compressed, and the neurovascular bundle inside gets squeezed. And when it gets squeezed, the nerves may not function properly. So a nerve entrapment, it doesn't only occur at the carpal tunnel, it can occur elsewhere in the body. A nerve entrapment is where a nerve which is running, when it starts to get compressed. And when that nerve gets compressed, the signal can't travel properly. So if I'm not able to, let's say, flex my hand at the wrist, what are some possible reasons? Well, maybe I have carpal tunnel syndrome. Maybe there's a nerve entrapment there. If I did have carpal tunnel syndrome, what would we need to do? Well, if it wasn't that bad, I might wear a brace. If it was kind of bad, but not, a brace wasn't going to help, I might get a steroid injection or physical therapy. But let's just say it's severe, I might need surgical release of that ligament, the flexor retinaculum, which will free open that ceiling in the carpal tunnel and allow the nerve to be free. But here's the thing, who wants to get surgery if they don't really need it? You certainly wouldn't want to send somebody for surgical release of the carpal tunnel if the problem wasn't actually carpal tunnel syndrome. So what do I mean by that is, well, maybe you have signs and symptoms of carpal tunnel syndrome, but maybe there's not a nerve entrapment here. Maybe the nerve entrapment is here at the elbow. And imagine if you got surgery here and it didn't fix the problem because the problem is really at your elbow. Or what if it's not at your elbow? What if it's in the spine? Or what if it's none of the above? What if you have a neuromuscular disorder? So what electrodiagnosis does is it allows us to kind of spot check the different parts of the body, the different nerves, and distinguish which parts are healthy, which parts are unhealthy. And this is an area, one thing that's kind of cool is where we apply a lot of the classes that you have to learn about in undergrad, like physics and chemistry. This is one area where you really need to understand your physics, not on such a super intense level. So how does it work? There's two parts to the test. There's the nerve conduction study, which is going to measure electrical flow through the nerve. And then there is, like I mentioned, the EMG, the electromyography, and that is how well does the signal get delivered to the muscle and how is the muscle firing? And let's talk about each of those. It's obviously a lot more complicated than this, but this is just sort of the basics in an intro to the topic. So nerve conduction study. So what do? So let's just say my hand, right? We weren't sure if it's working that well. Well, if you become a physiatrist or a PM&R doctor or a neurologist, you know where all the different nerves run. You take electrodes, you put it over different muscles, different sensations, and then you hold a stimulator. And you actually decide how much current you want to apply. And with your knowledge of where the nerve is, you stimulate a current there. And the signal, ordinarily, if I move my hand, my brain is sending a current down my nerve. What we're doing is we are taking a stimulator probe and we are sending an electrical current into that nerve. So it's not you sending the signal, it's us. And we're measuring how much signal we're sending. And then we measure with the electrodes that we put at certain key points in your hand, what kind of signal is getting across. Are we losing some of the signal? Is it more or less than what we would expect? So we would test the signal here, then we could test the signal here, test the signal here, test the signal here. It's a little bit of an oversimplification, and we can see where the signal goes awry, where we start to experience some symptoms of where the problem might be. We do that for motor tests. So when you actually send the signal, if you send it over that nerve, the person's hand is going to twitch every time you do it. But then we also do it for sensation. So we can measure the sensory nerves. The sensory nerves pick up information from the periphery and send them up through the spinal cord back to the brain. We can test those as well. So that's nerve conduction studies put loosely. EMG is a different thing all entirely. And in that, we take a needle that is hooked up to an electric wire, and we take that needle and we put it into the muscle. So if I'm concerned that the person might have a problem, over here, well, I know that the median nerve, this muscle, the APB, abductor pollicis brevis, is innervated by the median nerve, and I know where it travels, and I know that it receives innervation from roots cervical 8 and thoracic level 1. Or if I have an issue with moving my arm like this, that's the pronator teres, which is the median nerve. cervical 6 and 7, or the issue might be my triceps, which is the radial nerve, which is 6, 7, 8. So the thing is there that my point is that if you notice, some of those things I repeated, some of those muscles, I repeated the nerve. More than one muscle was innervated by the median nerve. More than one muscle was innervated by root cervical 7 and cervical 8. So what we can do is we can begin to localize where is the problem. It might look like you have a problem with your median nerve, but in reality, it might not be the median nerve. It might be coming from an issue higher up in your spine. So we basically, what we do is we take this needle, we put it into different muscles strategically using our knowledge of what sort of innervation innervates each muscle, and we start spot checking where is the signal going wrong. And we know a lot of patterns. So we know in that regard, where are there going to be, muscles that aren't firing properly, signals that are not being sent properly. And that's sort of the basics of it. We put the two of them together, and it's just one more tool for diagnosis. So that being the case, that's really kind of the intro, that in a nutshell. We have some other things to talk about tonight that we'll do after the live. Does anybody have any questions about electrodiagnosis in this intro to electrodiagnosis, nerve conduction, or EMG? Kept it a little brief tonight because it is a Monday night. So I saw there, what do you mean by nerve entrapment? We answered that. I think we're good for that then on the questions. So thank you for joining. Thank you for listening. We'll cut the feed now, and then we'll be able to answer some more questions about the program.